Let me just say that, this is supposed to be fun, right? It's a debate session, and I just want to tell you I have the utmost respect for Dr. Crawford and also for Dr. Morgenthaler, Dr. Kara, who, the three of them have published collectively. But if I wasn't assigned the con side of this argument, I probably would have declined to present the pro. And I've given that pro talk. And maybe he feels Matt's talk was balanced earlier. I've given that same talk and discounted these articles on cardiovascular risk for the same reasons he tried to present to you. Because I've seen Abe do it and Mo do it, and I was just at the Sexual Medicine Society. And when I asked questions about recent data showing a problem, they weren't addressed. They were dismissed. But you got to be careful. A lot of these meetings are funded by companies that supply these products. Look at the COI. It matters. Everything I'm going to tell you today, I believe, okay? And I think it's important for your practice. I don't disagree with a lot of what he said. I think that having an optimal testosterone may improve the reliability of PSA and may be beneficial for cancer. I don't think testosterone causes cancer. I don't. So I believe he was right on. But the debate is if it's safe and effective. And you got to think about it for your practice, okay? And so I'm going to highlight quality data because a lot of the data that they keep dismissing for its methodology, and then they want to cite meta-analysis of trash, of garbage studies as being valid, but all they are is a meta-analysis of trash. So let's get into it. How many of you have seen Indiana Jones' The Last Crusade? A lot of you, right? Remember the whole quest for the Holy Grail, right? The cup of Christ, right? Immortality. So a lot of these guys coming in, they want to feel young again. I can't believe some of the advertisements. Are you feeling older? Well, hell yeah, I'm feeling older. I'm getting older. You know what I mean? So the whole reason Florida was discovered was because Ponce de Leon was looking for the fountain of youth, right? You've seen these pictures, right? You remember the Balco scandal? All these guys getting busted for testosterone doping for performance enhancement, right? It's running rampant. Guys are coming into your office because Jose Canseco told them they needed it, right? Al Sharpton's on the radio talking about it. So is it the Holy Grail or is it the Pandora's box? Well, it's first used clinically in the 30s, 2 years after its Nobel Prize-winning discovery. Now it's nearly a $2 billion market, and the raw drug costs only 1% of the total, and that's a better return than street drugs, okay? So a 2003 Institute of Medicine panel included there was insufficient evidence of benefit in older men and recommended a coordinated set of clinical trials, okay? No benefit established, so we need trials. So I'm not even going to go and criticize or even try to tout the benefits of the studies that were criticized. I can make a case completely apart from them. So you heard about those 4 articles earlier from Matt, right? So you had 2 retrospective reviews with poor methodology. I agree. 1 meta-analysis with questionable studies and events. I agree. And 1 prospective trial with few major adverse cardiac events. Also agree. No problem. So we heard about the New York Times editorial. We heard about the Endocrine Society warning against the use in older men for coronary artery disease. We heard that this morning. And then the FDA announced plans to review safety. And of course, the plaintiff attorneys were looking for cases of heart attack and stroke for class action suits. These are all over the internet, right? If you haven't seen some of these guys in practice, you might, especially if you're someone that's prescribing a lot of testosterone. And remember, a lot of the guys you hear, advocating for this run practices where that's all they do. They don't operate. All they do is provide testosterone, similar to your injection clinics, that you may be competing with. So you have to make an informed decision, right? So to know that you can choose wisely, think back to the movie. So there were 7 T trials, okay, that were initiated, and they were to establish benefit rather than risk. And that doesn't seem to make sense, right? Wouldn't you want to know if it's safe before you go studying it for benefit? The answer is no, because it takes a lot more time, a lot more funding to do the studies as it relates to risk. First, you have to know if it's even worth exploring. So they did a physical function trial, sexual function, vitality, looking for fatigue, cognitive function, the anemia trial looking at hematocrit hemoglobin, bone trial looking at density, and the cardiovascular trial as it relates to plaque volume. What's the number 1 killer of men? Heart disease, right? So that's important. Probably a lot more important than prostate cancer. So for these trials to enroll, men had to qualify for at least one of the 3 main trials: sexual function trial, physical function trial, or the vitality trial. Looking at their baseline, Cunningham published this and looked at the baseline measures, and this was based on 12 sites in the US. Free and total testosterone were not associated at baseline with measures of vitality or physical function in symptomatic older men with low T qualifying for these trials. Now remember, this is level 1 evidence. okay? The other stuff that was cited to you for benefit was not, mostly retrospective, especially when they keep trying to tout the studies by Molly Shores in the VA population. You're not going to hear this talk anywhere else, so feel free to stop me at the end or for the panel discussion. Looking at the vitality trial, physical function, testosterone replacement had no significant benefit for vitality based on the main questionnaire that they used. Okay, that was the tacit questionnaire. There was no significant improvement in activity from testosterone replacement in the physical function trial. However, I will acknowledge that if all 3 trials were pooled, there was an increase in the 6-minute walking distance. There were 4 cases of prostate cancer, 3 in men on testosterone replacement, but it wasn't powered to assess this, all right? So we'll leave that one alone. What about sexual function? Okay, nearly 800 men, we're looking at senior citizens with a level below 275 and having symptoms. They either got a placebo gel or the testosterone gel for a year. And it was designed to achieve levels consistent with what was felt to be mid to normal for guys between the ages of 19 and 40. And it was associated with significantly increased sexual activity, sexual desire, and erectile function. Sounds like a home run. It's not. The improvement was modest and less than that reported for phosphodiesterase inhibitors. 2.64 points on the full-length IAF score. And you remember from my earlier lecture to keep this in perspective. So, Bessaria, who had earlier studies too, we talked about the TOM trial and these older guys, bench pressing on all these super high doses of testosterone. They have something called the TEAM trial as well, which came out. And this is separate from the T trials, but I'm just adding it here for additional information. Testosterone did not significantly improve erectile or ejaculatory function, sexual desire, partner intimacy, or health-related quality of life, consistent with meta-analyses of older testosterone trials. So even if current data suggests there's a minor benefit, you can see a lot of the other data suggests there's no benefit. So at best, minor in the sexual realm. What about cognition, right? I heard Dr. Morgenthaler and a lot of people before these trials came out saying it might help visuospatial skills and cognition. Maybe we could use it in patients with Alzheimer's dementia. It sounds great. Again, looking at the same number of guys, same methodology, almost 500 with age-associated memory impairment, no benefit. These were the endpoints. Going back to that TEAM trial update, again, 2016, testosterone replacement for 3 years to range old levels to young levels, no improvement in cognitive function, absence of effect was evident across all domains of cognition tested. Concluded, testosterone to improve cognition in older men with age-related decline, not justified. What about bone health, right? We talk about improving bone density, right? Estrogen, right? Think about conversion. We talked a lot about physiology earlier this morning. So 211 men, again, in the T trials, published in JAMA, volumetric bone mineral density was assessed at both the spine and hip by CT scan at baseline and again at 1 year after therapy. And they saw a significant increase in both locations. Okay, so it increases bone density, not tied to any clinical benefit. But let's say that's a positive. What about anemia, right? Those of you that are giving testosterone know you should follow up on the CBC. Check the hematocrit. If it gets hemoglobin above 18 a lot of times, which is multiply times 3, 54 on the hematocrit. If it's too high, maybe you have your patients giving blood. Maybe you give them a holiday. Maybe you're doing something else. The main outcome measure in this study was the percentage of men with unexplained anemia with a hemoglobin rise of 1 gram or more at 1 year. Okay, so testosterone did better than placebo. No surprise, right? Was there a clinical benefit tied to this raise? No. But again, the argument of performance enhancement by raising testosterone, go back to the Lance Armstrong pictures and so forth. Well, what do we know about raising the hematocrit? What about in the guys that come in with normal levels and you're putting them on it? Well, there's a TAMR study. It was a Finnish study looking at 670 men over the age of 55, followed for 28 years. And they looked at those with hematocrit below 50 to those with or higher than 50. Those with higher hematocrit were 2.4 times more likely to die from coronary artery disease. And that was significant. After adjusting for the established risk factors, it remained significantly high, 1.8. So this is the big one, right? And this is the one that Matt touched on briefly and then started to criticize. But this is the best designed study out there for this, okay? And these were the studies that were designed to answer these questions and decide if it's even worth doing a men's health initiative like they did for women. The hypothesis was that testosterone would slow progression of non-calcified coronary plaque volume. And that's the bad type, right? And so they had a CT angiogram at baseline and again in a year, and there was actually a significant increase in those men receiving androgel relative to placebo. No major events, but it wasn't long enough, and it wasn't designed to follow them for that, okay? But this degree of coronary luminal narrowing in only 12 months is unprecedented. It's been called an unprecedented drug effect, and it appears ominous. Can you imagine getting a drug to market right now if you showed a significant increase in coronary plaque volume in only 1 year? But these are some of the things they say. Those were older men, and the testosterone group was worse at baseline. I heard this at this year's SMS. Remember the levels of evidence when you're comparing data. Let me take you back to my childhood. I was born in the 70s, and I grew up largely in the 80s. You know what I liked? I liked pro wrestling, okay? Macho Man Randy Savage, snap into a Slim Jim. I love this guy, right? Died at age 58, had a heart attack while he was driving, was a long-term steroid user. Well, maybe you say, oh, okay, well, he was a little older anyway. The Ultimate Warrior, love this guy too. Great moves every Saturday morning. He admitted to testosterone use and claimed it was rampant in the field. Died at age 54, MI due to atherosclerosis based on autopsy. All right, still, he made it to 54. Chris Benoit, one of the Four Horsemen when they reinvented it. It was awesome. Died at age 40, killed his wife and his 7-year-old son before hanging himself, and was found to have 10 times the normal testosterone level. His best friend, Eddie Guerrero, died at age 38, atherosclerotic cardiovascular disease, and was outed in a Sports Illustrated report as a testosterone user. The British Bulldog, Davy Boy Smith, died May 2002, age of 39, MI. Autopsy report stated that anabolic steroids were causative. Flying Brian Pillman, also one of the Four Horsemen, dead from MI at age 35, atherosclerosis. Okay, don't be like these guys sticking your head in the sand. So these so-called experts continue to support this. But what if testosterone is one of the difference why our life expectancy is the same as women, right? You see these associations that he showed you as far as testosterone coming down and cancer going up. But again, it's guns and butter if you know anything about economics, and you've taken those lectures earlier in life. Think about the Women's Health Initiative and the potential parallels, as estrogen did increase the risk for stroke and pulmonary embolism. Another wrestler, Roddy Piper, died of cardiac death with a massive PE, okay? Bret the Hitman Hart you might have heard of because he had prostate cancer, right? He was picked up on that, suffered a stroke, and was also diagnosed with this cancer subsequent to that. So in the words of my kids, just saying. John Brinkley, how many have read this book, Charlatan by Pope Brock? Do yourself a favor, get a copy. It's awesome, okay? So, he was born in the late 1880s in impoverished North Carolina, was called a quack and a snake oil salesman, and put ads in the paper saying, are you a manly man full of vigor? He injected color distilled water, faked his medical degree, got bailed out of jail, and took a job as a house medic at a meatpacking firm where he saw the mating habits of goats, okay? So, George Lidston and Sergei Voronov were famous for implanting human testicular tissue or monkey gonads into elderly men to improve virility. So Brinkley took goat testicles and put it into a farmer who claimed a sex drive with full speed afterwards. He goes to LA in the 20s on Wilshire Boulevard to advertise, which was also named for a charlatan, by the way. He built a radio station that could be heard all over the world and was eventually exposed and retreated to Mexico and created the most powerful radio station. And by the end of the 30s, he had $12 million. He was like the inventor of concierge care, but he had all these people believing that they could feel younger because he was going to put goat testicles into them. This is number 3 of my 4 kids. So Shay, he's awesome. I love this kid, right? But you know what he wants all the time? Candy. Why? Makes him feel good. Seems to have more energy. But when it wears off, he crashes, and then he craves more. Sound familiar? Long-term, presumably a risk of other problems. But patients want it, and you have Press Ganey scores and online satisfaction to think about. And giving them a prescription makes them feel you did something for them. So what's the harm? Does this sound like anything else? Remember the Z-Pack? Right? How many patients wanted this for their viral upper respiratory tract infection? Sales were crazy, through the roof. And then the following year, the FDA warned that there was an associated risk of cardiovascular death. And now we have a lot of resistant bacteria. Well, they're well informed, right? So it's okay if they have informed consent. Well, maybe their lawyer might not think so after their cardiac stent. And when they get those injections in your office that come out of the bottle, right, are they seeing that the FDA is requiring a labeling message like they would if they got androgel at home? Probably not. So I see these guys all the time. You know, a clinic full of guys, 45 to 50 years old, missing the glory days, needing their prior auth forms filled out, come in the Jesse Ventura workout pants, huge arms covered in acne, hairlines running for the hills, and their testicles look like raisins, touting their witch doctor provided regimen of testosterone, HCG, Arimidex, DHEA, and a garbage bag full of products from GNC, asking you to hurry so they can get to their chiropractor. So it's the new normal, right? So they're hoping for a less stigmatic solution to ED in most cases. You might think that they're there to treat hypogonadism. A lot of these guys want better erections is really what they want. So oftentimes, they may see minimal clinical benefit, okay? But there's potentially a placebo effect, but it doesn't mean that they won't suffer in withdrawal, right? You get their levels up, and then they don't stick with these therapies very long. And then what happens? It bottoms out, so it's lower than where they started. And they go, oh yeah, it was helping me. Well, no, because I just made you worse, right? Like Janet Jackson said, what have you done for me lately? And from the GNR song, I used to do a little, but a little wasn't doing, so a little got more and more. That was in reference to cocaine, but you can see the relevance here. So what are you chasing? A symptom, a questionnaire score, or some arbitrary magic number on a blood test so you can convince a patient that they're better and it's worth getting the metal trocar in their rear end every few months to slide in some pellets, then in case you never look closely, have glass shards attached to them, okay? Which is why risk management pulled it from my hospital. There's AUA resources on this, a position statement that says only FDA-approved medication should be used. For the patients you're probably treating, it's off-label. In conclusion, no benefit for physical function, no benefit for vitality, no benefit for improved cognition, modest increase in sexual function early on, improved bone density and anemia, but a potential risk for raising the hematocrit, a potentially dangerous increase in coronary plaque volume, which is never a good thing, and given it limited efficacy from the T trials, public funding does not appear warranted to support long-term powered randomized trials for cardiovascular risk. Remember how to be a good doctor like we heard about earlier? Give sound advice. Weight loss, moderate to high intensity exercise, which can drastically change testosterone one day to the other. That's why you need 2 values early morning before you start therapy. Sleep hygiene. I can't tell you what a factor that is, right? If you get people to sleep better, testosterone levels rise. Reduce their stress. Look for other things that can give them better energy. Look at their diet. And maybe you too will help them choose wisely. Thank you.